Hello, this is Dr. David Green, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is what you need to know about spinal cord stimulator implants. Well, what exactly is a spinal cord stimulator? It's a revolutionary device that is permanently implanted around the spinal cord in an effort to provide pain relief to chronic pain patients. It's been shown to work well for either chronic back or leg pain, or if you put it up in the neck, it could be neck pain or arm pain. And it's considered a last resort treatment, as it does involve surgery. It's very expensive for insurance companies, and it doesn't fix the problem with the back or leg pain, but it can mask the pain nicely. Well, who has an indication for a spinal cord stimulator? Once again, it's not a first-line treatment. It's usually a last resort. It doesn't fix the problem, but it can mask it very nicely. So it's a great last resort option for those who have failed back or neck surgery syndrome, and there's no further indication for surgery. So really they have no other option but either medications or something like this. Postlaminectomy syndrome is an indication. Reflex sympathetic dystrophy or complex regional pain syndrome can benefit from the procedure. Diabetic or peripheral neuropathy can work extremely well, and there are forthcoming indications for testicular, pelvic, and abdominal pain. There's some studies showing those work well. Well, what can it do for chronic pain? It can take a person with chronic pain, depression, and inability to work and essentially turn that person's life around. It's been shown to work well, as I mentioned, for back, neck, arm, and or leg pain. Basically what it does is it emits electrical impulses around the spinal cord, and it can modify the way the brain perceives pain signals. So it can replace the pain signals with a tingling sensation. You do need to have a trial stimulator placed first, and that's a low-risk procedure. If surgery is not an option, it can be an excellent last resort option. It can decrease the need for narcotics as well. So the first step in receiving a spinal cord stimulator is what's called a trial implant, and that's placed percutaneously with two tiny leads. It's attached outside the skin to a programming device, as you can see on the right in the picture. It is placed under sedation, but the person is not knocked out because the pain doctor does need to ask the patient questions during the procedure. So as they're placing it, they'll ask the patient, and they'll turn it on, and they'll say, can you feel coverage in the leg, area of the leg that's bothering you, or in the back? And then it's kept in place for 5 to 7 days to see if it's going to work. And usually the litmus test is whether or not it provides over 50% pain relief. Then an individual needs to also have a psychological evaluation to make sure that it's okay to undergo the procedure. Now, how is the final procedure implanted? It takes about an hour. It's under general anesthesia. It consists of a large paddle lead for better coverage. I'll show you one of those in a minute. You do have to have an incision and a small bone removal, either a laminectomy or a laminotomy, and the leads are tunneled under the skin to the battery, which is placed subcutaneously either above the buttock area or maybe around towards the abdominal region. Basically, you don't want the patient to be sitting on it because that promotes skin breakdown. The latest spinal cord stimulator programmers have over 200 options, which is great for leg and back pain. The newest ones are rechargeable through the skin, which is excellent considering they're a lot smaller profile. And the newest ones also don't lose coverage as a patient goes from a sitting to a standing position or laying down. That was one of the biggest problems with the early spinal cord stimulators. Well, how well do they work? First of all, here is the paddle lead, what the final ones look like now. And you can see that they have a lot of diodes on them, and that is where they get all the programming options. And here you can see the size of these now. That's a quarter, so these battery packs are very small now. And one of the great things, as I mentioned, is they can be recharged through the skin. So a St. Jude study showed that 84% of those receiving a spinal cord stimulator had a greatly improved quality of life. There was a study in 2006 showing over 3/4 had good to excellent pain relief. For diabetic neuropathy, over 85% experienced a substantial recovery of their lost sensation, and also over 75% had substantial pain relief from their neuropathy. There was a study in New England Journal of Medicine showing that for reflex sympathetic dystrophy, spinal cord stimulators work extremely well for pain relief, and that's over 85% as well, especially if you get to it within 2 years. Well, what are the risks of a spinal cord stimulator implant? The risks are substantial, but they're not usually life-threatening. I mean, for instance, the device may stop working after a couple years. It can migrate early on. It may need some tweaking. That's pretty common. There's a common risk of infection. Usually there could be some bleeding and a little bit of wound breakdown. A lot of times when that happens, it just goes on to eventually heal, but these are not risk-free procedures. Arizona Pain Specialist has the most comprehensive pain management in the Valley with 6 locations. They're a one-stop shop. They have board-certified and award-winning pain management doctors, chiropractors, spinal decompression therapy, acupuncture, and PT. They accept over 50 insurances, and the pain doctors have won the Patient's Choice Award 5 years in a row. Call today for scheduling at 602-507-6550 or visit us on the web at preferredpaincenter.com. I'm Dr. David Green with the Arizona Pain Network. Your pain stops here.